Hello there, and welcome to another edition of Health Matters, a presentation by the Ministry of Health. Glad that you can be with us on our program. Our program today, we'll be talking about a well-being study that's about to begin or started in the preparation stage here in Guyana. And it's being done by the Ministry of Health in collaboration or together with the Columbia University out of New York. I've got with me Dr. William Adicro, no stranger to Guyana. He's director of the Guyana Mental Health and Wellbeing Project. I've got Dr. Christina Hoven from the Columbia University Medical Center, and Dr. George Musa, who is a medical geographer, also with the Columbia University Medical Center. Ladies and gentlemen, welcome to the program.
Thank you.
Dr. Adicro, I'll talk with you first. Tell us a bit about this study. What's this all about?
Well, the study seeks to find out the true numbers of suicides and attempted suicides that we have. So that's one. And what are the issues that lead to them, so that once we know the true causes and the true numbers, we can have programs that can be put in place to mitigate those things. Dr. Hoven keeps saying that it's not the normal study where we ask the normal things. This is an in-depth study so that we can begin to look for some of the predictive factors. And that's what the study is about. I think later on, I think Dr. Hoven can talk about it some more. The fact that we are also taking some water samples and some DNA samples as well.
Right, so let me bring in Dr. Hoven here, and I'm quite intrigued by this statement. The Guyana Wellbeing Study, great promise to provide insights into suicide risk. What are you hoping to have here?
Well, what we're hoping to have is to actually identify the previously uncovered risks here in this country. Guyana, as you know, has one of the highest rates of suicide in the world. It's had that high rate for many years consistently. Other countries have fluctuated. They've gone down over time. They've maybe gone up a little in the recent past. The ages of people being at risk throughout the world has come down. It's now more prevalent in younger people than it ever was. But the reasons why in Guyana, why this consistently high rate is unknown. There have been smaller studies here identifying the usual risk factors that we could identify basically without doing a study. There are differences between men and women. There are differences across the ages. There are differences by religion. There are differences by ethnic groups. We know those things. But why? Why do we have these high rates? High rates in almost every group. So it requires a different kind of interview to find out questions that will help us understand what is putting individuals at risk within these different groups, whether it's by age or whether it's by gender. What are the risk factors? They're obviously the same risk factors here, but in addition, there are other risk factors, and that's what we're trying to find out. What are those other risks?
Dr. Musa, what's your role in all of this?
So
I'm pretty intrigued as your what's the word? Medical geographer.
So
right.
I concentrate on where disease is and where the facilities are, and that's where the geography aspects comes in. Much like an epidemiologist, but I concentrate more on the location than the disease itself, and the role that contextual factors like neighborhoods where you live plays in different disease. Specifically mental health. I concentrate more on mental health than anything else.
Right. Dr. Adicro, why the word or the phrase well-being is used here?
I think as Dr. Hoven normally says, it is not good to dwell on the negative all the time. I think the negative is suicide, depression, mental health, per se. But we are looking at the totality of the human being in terms of being well health-wise, and everything that we do is to maintain that health. And I just want to put in a thought that at one point in time the ministry was looking at that why are we looking after diseases? Why don't we create? And I think Dr. Berry Ramsaran's time. Why don't we create a clinic whereby people who are well, can just pass through and say, I'm passing through 5 minutes. Please check my blood pressure. Please check my sugar level. I'm not sick. I'm well, but I just want to maintain my wellness. So I think that connotation of positivity goes a long way. And I think you may have said at some point, when you hear the word mental health, it throws many people away. No, I'm not sick. No, I'm not mad. But mental health and wellness is not just being frankly mad, but it's a whole spectrum that we all fit in that spectrum.
I can just imagine before we go to take a break that you approach people to be interviewed and said, we're here to do a suicide research or a mental health research, and then they will tell you, do I look mad to you? Right.
Sure.
So we'll take a break, and when we come back, we'll have more for you.
It's here again. Join us for the second annual Guyana Mental Health and Wellbeing Conference, slated for November 15th to 18th, 2022. Meet us at the Arthur Chung Conference Center for all-day events with refreshments and networking opportunities. Come out and hear from our speakers locally and from across the globe as we seek to bring awareness to general health and well-being, with a focus on mental health, suicide, trauma, injury, and many other topics. All are invited and admission is free. This event is being hosted by the Guyana Mental Health and Wellbeing Projects team in collaboration with the Ministry of Health, University of Guyana, Columbia University, and other partners. To register to attend or for more information, please visit our website at guyana-well-being.org. So save the dates and be there for Guyana Mental Health and Wellbeing Conference from November 15th to 18th, 2022.
Welcome back. This is Health Matters. We're talking about the Guyana well-being study that's going to be taking place and have started in the planning stage. And Dr. Hoven, it's here a comprehensive longitudinal examination. What is this? What are we talking about? What's happening here?
Well, as we said earlier, that we're trying to uncover the hidden risks, the ones that are not the obvious risks in this culture. And to do that, we're doing it longitudinally, which means we will do assessments multiple times, once every year, for example. We'll go back to the same people, and we will be able to look at trends over time and better understand how risk leads to well-being and how it leads to perhaps less well-being. So that's the purpose of the longitudinal. It's a comprehensive study in that we are looking simultaneously at three different populations. One, a nationally representative population, which will give us a chance to look in every corner of the country, whether you are, whatever race you are, whatever ethnicity you are, whatever religion you are. We want a representative sample so that when we're done, we will be able to say with great confidence that these numbers are reflective of this population at this point in time for every group. The other thing that we will be doing, and that will be a very large sample, and it will be longitudinal. The other thing that we're doing is we're looking at people who have attempted suicide, and they will be coming to a clinic or to an emergency room, and we will attempt to interview those people and another person who knows them very well to try to understand what led to that event, and we hope to follow them longitudinally to see what happens to them. And the third group that we're looking at is people who are a family member of someone who's died by suicide. And unfortunately, that's a very large population in this country. And we will be interviewing a family member, or at least a person who knows that person the best. It may not be. It may be a best friend. It may be a lover. It may be a neighbor. But it will be two people who know that person very well and can help us to understand why they think that person died by suicide. So those three interviews, which have never been done before, No one has ever looked at these three different strata, and no one has ever used the same, obviously used the same instrumentation to assess these three levels. So that's what it means by being comprehensive and being longitudinal.
In Guyana recently, we have seen, at least in the press, young people, almost we want to call children, school-age children. And I know, Dr. Musa, when you're looking at your places, but sometimes places can be an institution, as the case may be. Do you think this study will be looking at a particular group or a particular place in terms of institutions?
We're not doing institutional populations in this study. We do have a colleague, Dr. Ellen G. Denton, that has done some work in the orphanages, and they have very high rates of suicide as well. But because we're trying to do a different type of study, we're concentrating more on the populations, the vast majority of the populations that are outside of the institutions. The other thing I also wanted to add in terms of the risk factors, yes, we're looking at the risk factors, but we're also looking at the protective factors. What are the things that might protect you from a suicidal thought and behavior?
Dr. Hoven, in some presentation recently, there was talk about suicide is not equally distributed in terms of you have genders, socioeconomic. And it's pretty interesting to see the figures for men and women and who are the ones who would most likely be inclined to do what they do to bring the end of life or self-harm, as the case would be. And tell us a bit about that.
Well, the expression, it's not equally distributed, one of the ways to look at that is to think about where are the suicides in the world. So we know that about 80% of the suicides take place in the developing world. But we also know that 80% of the population lives in the developing world. So that's a real difference in terms of economics. But when you look within a given population, you know that there are differences among religious groups. You know that there's differences among the wealthy and the poor. Why? Well, some of the explanations are very clear. If you are, in fact, if you have the money, you can go seek services. If you're becoming depressed, you can go get medication. If you're poor, you may not see a doctor. You may not get the medication. So you may, in fact, spiral into a deeper depression and ultimately take your life. So it's not equally distributed across any of the variables that we know of. Race, age, gender, economics, it's not equally distributed. So why is that, and what can we do about it? So the Ministry of Health here in Guyana is committed to doing this particular project because they want to identify the most at-risk groups for suicide. And they can only do that with good data so that the Ministry of Health can develop targeted programs, whether they be for the very poor or they be among Hindus or they be among Muslims. What are the groups that we need to target and how should we provide those services? Only the people can tell us that. That's why we need an in-depth interview to find out what people are thinking, what they're doing, what they want, and what works for them. And that's what the ministry wants to know so they can do more and do better.
Dr. Adiko, here's the million-dollar question. How will you and your team go about getting persons to be interviewed?
Well, for now, we have a team put together, trained by my colleagues from New York. And these are social workers, psychologists, nurses. We used to have one doctor as well trained. And these persons are taken through a 4-day comprehensive training program in the art of interviewing. So once that is finished, all cases that appear at the health posts, health centers, regional hospitals, and GPAC, private institutions, are all funneled through. One of them is through the surveillance units. That takes time, but we want to get that. We want to get all data from the accident and emergency points. We want to get data from all the health centers, health posts, and the district hospitals, so that we can interview all of them and get the data, so that everything that Dr. Hoven Dr. Musa talked about, we can find what are the true issues at play with each particular case, and look at the population as a whole. What are the real predictors? And I think George mentioned it, so that later on we can look at what are the major risks that are at play here and what can be done by society to mitigate them.
So even though you might not get people, let's say, who are on a radar, can people who have been affected, families and others, can would there be some sort of an opening whereby they can make contact with you? Would that be also a part of your research protocols?
Sure. I think persons who call, and I think Christina can add more to that. We normally take persons who have already been diagnosed by the Ministry of Health. So if someone calls, we could still investigate that, but that person should have gone through a system and be diagnosed, because we do not do the diagnosis, the diagnostic aspect. So once it's deemed that the person has been diagnosed by the health system as having either attempted suicide or committed suicide. If the person has committed suicide, then obviously we speak to families and friends who know the person best. If it's the attempter, then we speak with the attempter as well.
Yeah, just to clarify, for the scientific rigor, a study like this cannot be somewhat of a free-for-all. It has to have limits. And one of the limits of that people who have died within the past 3 months and at any point, and if we haven't contacted them, they can contact us. That's true. But it's only for 3 months. We are expecting to get 100% of notification through the ministry of people who've died. So going forward, there shouldn't be anyone that we miss, but anything can happen. So yes, if they can contact us within 3 months, if we didn't contact them, absolutely. But as Dr. Adekro said, the people will be identified through the healthcare system, either in the emergency room or notification of death. So that's true. The other thing I want to be very clear about, these studies are not being done to look at individuals. Although all of the assessments will be thorough assessments of individuals, we are epidemiologists and we are looking at population data. Every interview that we do is completely confidential. It has been through every institutional review board in New York, every institutional review here in Guyana. They are completely confidential. Not only are they confidential, but the people carrying out the interviews have a sworn statement that they cannot violate anyone's confidence. They will not interview anyone that they know, anyone in their neighborhood, nothing like that. It's completely confidential. And we're hoping that the people of Guyana who have this terrible plague of suicide will join with us and try to answer these questions to the best of their ability. They don't have to participate. They never have to answer any question they don't want to answer. But this is a national problem, and we're asking the people of Guyana to join in and help us solve this problem. And the only way we can do it is together and with data. We need everyone who is approached to join us.
So we'll take a break, and when we come back, we'll have our final segment. This is Health Matters.
It's here again, the Guyana Mental Health and Wellbeing Conference on November 15th to 18th, 2022 at the Otter Chang Conference Center. Hear from medical experts as they bring awareness on mental health, suicide, trauma, and injury, not forgetting general health and well-being. Doctors, nurses, social workers, psychiatrists, and the general public are all invited. Admission is free. Local physicians attending will be awarded with CME at eligible sessions. For registration and more information, visit our website at guyanawellbeing.org. This event is being hosted by the Guyana Mental Health and Wellbeing Projects team in collaboration with Columbia University of the USA, the Ministry of Health, the University of Guyana, and other partners. Save the date and be there for the Guyana Mental Health and Wellbeing Conference from November 15th to 18th, 2022.
Welcome back to our program. We've been speaking with persons who are in Guyana to start up this monumental, this huge task of the Guyana well-being study that will no doubt provide lots of information to help persons living in our country. But they'll be having a well-being conference coming up in November, and ask Dr. Adikro more about this. Dr. Adikro.
Yes, last year, Dr. Hoven, it was COVID time. We really wanted to get things going, and she came up with this brilliant idea. Whilst we are all locked up, why don't we have a conference to let people know what is happening, what is out there, what other persons are doing to mitigate the same, and get to know the players and build coalitions, build partnerships. So she came up with the idea, and so said, so done. So we had it last year, and this year we are hoping to have it again, November 15th to the 18th. And yes, my boss keeps on saying that it's free, so you can attend. It's not the type of international scientific conference that you have to attend and pay. I was getting tempted to mention one that we have to pay, but yes, this one is free. And it's from that Tuesday, that week of November 15th to the 18th, morning and afternoon.
And who should come?
Everybody, healthcare workers, social workers, psychologists, psychiatrists, persons who take care of persons who are survivors, parents who are interested in well-being. So it's really targeted, at everybody.
And what, Dr. Hoven, what can be some of the outcomes? What people who want to come, what will be the benefits?
Well, the whole idea is that this is, as Dr. Adikro said, it's not the usual international scientific community conference. It is an international scientific conference. There will be leaders in well-being, mental health, psychiatry, whatever, from all over the world who will be here, they were here last year. Many of them who couldn't come last year will be here physically this year. There will be opportunities to ask the experts. We will cover a whole range of well-being topics, from genetics to how do you run a group for depressed elderly. There will be a whole range of topics. We want to use the conference to inform the professionals, to inform the non-professionals, and to make everyone aware that mental well-being, psychological well-being, health and well-being, it all goes together, and we all have to work on it together. And to do it, we should be well informed.
Even while you're, Dr. Hoven, whilst you're here specifically to do a study on mental health, I think you're going to be promoting something on a national front, well-being being something which should be in the front burners, both for public and private sector.
Yes, and I think Guyana is fortunate to have a minister who's very interested in making well-being as opposed to ill health a calling card. It takes everyone on board. So we are trying to work with the Ministry of Education. We're trying to work with the Ministry of Social Welfare, with the university. All the partners need to come together. This is not a Ministry of Health problem. This is not a mental illness problem. This is a health and well-being situation. And the only way we can change this, what has become part of the culture, the suicide phenomenon has become part of the culture. And the only way we can change that is to try to understand it and then target interventions to address the people most in need. We're never going to be able to do everything for everybody, but we certainly can do better. And we can only do better together. So the conference is an opportunity to bring anyone that wants to learn, wants to share, wants to experience the different things that the conference has to offer. Come, and it will be very exciting. There will be people there, with all kinds of credentials, and there'll be people there who have no credentials. Everyone is welcome.
As we wrap up and we go back to the study that's going to be happening or is about to start, Dr. Adikro appealed to the public who will be taking part whenever the team turn up, you need the support, and you're guaranteeing all sorts of confidentiality and so forth. If you could just remind the public, especially those who will be visited by team members.
I think Dr. Hogan did mention the fact that it's confidential, totally confidential, and has gone through the rigors of protection of human subjects, both at the U.S. level as well as in Guyana. In fact, in Guyana has gone through the process twice. So people can be assured that their interest happens to be at heart in the planning. My appeal is that persons contacted should find time to meet with the interviewers to answer those questions. It's akin to the census that we do. Why do we do census every 10 years? So that we know the number of persons we have, so that planning can be done for them. If we don't know what is happening in terms of the mental health arena, self-harm, how is the government going to plan for them? So we definitely need to know. And whatever they do, the fact that they agree to answer those questions are going to help, if not save themselves, save somebody that they know. Because in this country, almost everybody knows somebody who may have attempted suicide or may have died from suicide.
We've been talking to Dr. Christina Hoven and Dr. George Musa from the Columbia University Medical Center, and Dr. William Adikro, Director of the Guyana Mental Health and Wellbeing Project. This has been Health Matters. I am Nazim Hussein. Thank you for joining, and thank you for being on our program. Do join us again next time. Until that time, stay safe.
It's here again, the Guyana Mental Health and Wellbeing Conference on November 15th to 18th, 2022 at the Otachang Conference Center. Hear from medical experts as they bring awareness on mental health, suicide, trauma, and injury, not forgetting general health and well-being. Doctors, nurses, social workers, psychiatrists, and the general public are all invited. Admission is free. Local physicians attending will be awarded with CME at eligible sessions. For registration and more information, visit our website at guyanawellbeing.org. This event is being hosted by the Guyana Mental Health and Wellbeing Projects team in collaboration with Columbia University of the USA, the Ministry of Health, the University of Guyana, and other partners. Save the date and be there for the Guyana Mental Health and Wellbeing Conference from November 15th to 18th, 2022.